Peptides have real potential to help you with body composition, fat loss, recovery, and feeling your best at any age. But right now, a lot of people are approaching them in ways that are not only ineffective, but genuinely risky. As an integrative and cellular medicine specialist, I see this all the time. So in this video, I'm breaking down the truth about peptide self-experimentation, the critical mistakes people are making, and how to actually use peptides safely and effectively without putting your health at risk. Just a few years ago, peptides were something only bodybuilders and anti-aging doctors knew about. Now, they're everywhere. Your social media feed is filled with fitness YouTubers breaking down peptides like BPC-157 or growth hormone, racking up hundreds of thousands of views. Major podcasters are spending hours raving about how GLP-1s changed their lives. And behind all the hype is a booming business making it ridiculously easy for anyone to get their hands on these compounds. We all know people aren't buying peptides for research. They're injecting them into their own bodies without a doctor in sight, watching YouTube tutorials on how to inject, treating their bodies like a science experiment. And then here's the thing. There's nothing inherently wrong with peptides. These compounds have been used as life-saving drugs for nearly a century. They've helped people heal injuries, lose weight, boost their immune systems, and extend their health span. When you hear about BPC-157 repairing injuries or tirzepatide driving 15 to 20% weight loss, that's not hype, the science backs it up. So if peptides work, where's the issue? Problem is the DIY peptide movement. It's convincing people that all you need is a few articles, a couple of videos, and an online order form. The reality is, most people doing DIY peptide therapy are making serious mistakes. Not only are they wasting their money, they're risking their health, which is exactly the opposite of what they're set out to do. That's why in the next few minutes, I'm breaking down the 5 biggest mistakes people make when they try peptides on their own. Mistake number 1, treating peptide therapy like Band-Aids when you need actual healing. Most people use peptides the same way they use regular medicine. They have a symptom and they want something to make it go away. They want growth hormone peptides to feel younger, but ignore that they sleep 4 hours a night and eat junk food. They want weight loss peptides while drinking soda and sitting all day. Peptides are powerful tools, but they can't fix broken biology. If you have constant inflammation because you eat poorly, BPC-157 might help for a few weeks, but the inflammation will come back because you never fix the real problem. It's like putting a fresh paint of coat on a house with a rotting foundation. It looks better for a while, but the structure is still failing underneath. This is the same mistake people make with regular medicine. Take a pill for every problem, never ask why the problem exists. If you're using peptides this way, you're just swapping out one quick fix for another. The only difference is you're injecting it into yourself. Mistake number 2, picking the wrong peptide because you don't understand how they work. People think that all healing peptides do the same thing. They see someone get amazing results and assume it must work for them too. But that's not how biology works. Different peptides work through completely different pathways. Some signal your cells to grow, others tell your body to burn fat, some modulate your immune system, others affect your hormones. And what works for a 25-year-old bodybuilder building muscle will not work for a 50-year-old woman trying to fix her metabolism. These bodies have completely different needs, different hormone levels, different root causes. So the peptide either doesn't work or it's causing side effects you weren't expecting. You wasted money and possibly hurt yourself because you chose based on someone else's results instead of your own biology. Mistake number 3, stacking the wrong peptide combinations. This one is the one I see most common and most dangerous mistake I see. People assume that if one peptide is good, combining it with others that works through a similar pathway must be better. More stimulation equals more results. That logic is completely wrong and it can cause serious harm. A perfect example is stacking multiple growth hormone peptides on top of each other, like combining CJC-1295 with tesmorelin or throwing MK677 on top of either one of those. When you stack these, you're pushing growth hormone and IGF-1 far beyond what your body should be producing. And that doesn't mean diminishing returns, it means real problems. Worsening insulin resistance, severe water retention, carpal tunnel syndrome, and in people with certain risk factors, it could even promote abnormal cell growth. The research companies selling these combinations don't evaluate whether these stacks make medical sense, they evaluate whether it sounds good in a product description. Beyond the growth hormone example, there are countless combinations that interact in unpredictable ways depending on your individual health status, hormone levels, and underlying conditions. Without a full clinical picture, you have no way of knowing whether a given combination is safe for you specifically. This is exactly why stacking based on forum advice or influencer protocols is so risky. You're making pharmacological decisions without the medical context to make them correctly. Mistake number 4, using the wrong form of delivery for your goal. Most people don't realize that peptides come in multiple different forms, and the form you use matters just as much as which peptide you choose. Depending on the compound and the goal, peptides can be delivered by subcutaneous injection, intramuscular injection, intravenous infusion, intranasal spray, sublingual drops, topical cream, or oral capsule. Each of these delivery methods has a completely different absorption profile, bioavailability, in clinical application. Choosing the wrong one doesn't just mean slightly suboptimal results, it can mean the peptides does essentially nothing for what you're trying to treat. The clearest example I see is people using oral BPC-157 to address chronic musculoskeletal injury. BPC-157 has a genuinely impressive research behind it for things like tendon repair, ligament healing, and joint recovery. So someone reads about it, orders the oral capsule form, and because it's easier and there's no needles involved, they wait for their shoulders or knees to heal. It usually doesn't. And then they conclude BPC-157 doesn't work. But that's not the right conclusion. The issue is the delivery route in this case. The same logic applies across many other peptides. Compounds like samorelin or CJC-1295 are simply destroyed in the GI tract. They cannot survive oral ingestion. If you see these things being sold in capsule form, that's a red flag about the source. Intranasal delivery, on the other hand, can be highly effective for peptides targeting the brain. PT-141 for sexual function or certain neurotropic peptides because it bypasses the blood-brain barrier more effectively than other routes. The problem is that most people choose their delivery method based on the convenience or whatever form happens to be available from the source they found. They're not asking, what do the pharmacokinetics of this compound actually require, and where in the body does it need to work? That's a clinical question. And without the answer, you can take the right peptide at the right dose and still get nothing out of it. All right, finally, mistake number 5, using peptides nonstop without cycling off. People start taking a peptide and never stop. They think because peptides are natural, continuous use must be safe. They don't understand how the body adapts over time. Your body has something called receptor desensitization. When you use a peptide every day for months, your cells begin to ignore it. The receptors that respond to that peptide become less sensitive. You build tolerance, created just like caffeine or pain medication. Growth hormone peptides like tesmorelin or CJC-1295 are a perfect example. Used continuously without breaks, your growth hormone releasing receptors begin to downregulate. Your pituitary becomes less responsive. Patients tell me that the peptide worked great the first few months, then it just stopped. They feel tired and foggy even though they're still injecting. That's receptor desensitization from never giving the system a reset. And without anyone monitoring you, there's no way to know when it stopped working or if it's causing problems you can't feel yet. These 5 mistakes are why most DIY peptide therapy falls short, even when the intention is right. Understanding the pitfalls is a great start, but the missing piece is almost always clinical data. Without it, even a well-researched protocol is still a guess. This is exactly what we focus on at Vive Wellness. Not starting with a peptide protocol, but starting with you. Before we ever discuss which peptides might be appropriate, we run comprehensive advanced diagnostics to understand what's actually happening inside your body. Hormone panels, metabolic markers, inflammatory biomarkers, cellular health indicators. The kind of tests that go far beyond what your primary care doctor orders at an annual physical exam. Why does it matter? Because peptides don't work in a vacuum. They interact with your existing hormone levels, your metabolic function, your inflammatory load, your sleep quality, and your gut health. Without that baseline data, any protocol, no matter how well intended, is just an educational guess. What advanced diagnostics give you is a root cause map. Instead of asking, which peptide did I read about for this symptom, we're asking, what does your biology actually need? What's driving the fatigue, the body composition changes, the recovery issues, or the brain fog? Only once we have that picture can we design a protocol that's truly individualized. The right compounds, the right delivery form, the right timing, the right cycling schedule, the right supporting interventions, all matched specifically to your physiology and your goals. That's the difference between a peptide protocol and a precision medicine plan. Do you want to understand what your body actually needs before making any decisions about peptides? Vive Wellness offers a free discovery call with our team. On that call, you'll learn what advanced diagnostics are most relevant for your situation, what root causes may need to be addressed first, and what a truly individualized approach to cellular optimization looks like. The link to book your free discovery call is in the description below. Take the first step towards doing this the right way with real data, real clinical expertise, and a plan built specifically for you.